Hello, I'm Patrick Muck. I'm the Chief of Vascular Surgery here at Good Samaritan Hospital in Cincinnati, Ohio. I'd like to thank the Pegasus course directors for the opportunity to get involved with this wonderful series. As most folks know, this is the home of Dr. Fogarty and his open surgical embolectomy catheter over 6 decades ago. And really, it's a loved mechanism of action. It's proven and trusted, and it's been very efficacious through an open surgical approach to remove acute thrombus and embolus. So iCHOR kind of had an aha moment. They wanted to develop this kind of an endo-fogarty portfolio. Their must-haves included arterial and venous treatment options, the ability to manage distal embolization and blood loss, maintain rapid exchange and over-the-wire techniques, and certainly use robust balloons as well. So what does iCHOR Vascular do? Well, they replicate the successful parameters of surgical clot removal through an endovascular approach. It's non-surgical, it's non-drug, it arrests the blood flow, minimizes distal or eliminates distal embolization really, and it's designed to fit all anatomic vessels with a single device, always maintain sheath and wire. In the venous world, it avoids scarring and valvular damage. And in today's healthcare environment, it's important that it does not require capital expenditure either. Here you have the 7 French arterial system with a 10 millimeter nitinol basket and a 14 French venous system. Again, throughout the procedure, you maintain your sheath and you maintain your wire access. And the venous system has an 18 millimeter nitinol basket. As far as the arterial system, it'll be available this year. Here it is in a swine model. You can see to your left an iliac, external iliac and common femoral thrombus. Here in the middle, you see the gentle eye sweep with the balloon, which is atraumatic, and the semi-compliant balloon, and there's the final angiogram, and that'll be available this year. I myself have experience with the 14 French venous system. At the bottom, again, you have your balloon, you have your wire, your sheath here at the end, and here's your basket. So the entire time you maintain wire access, and this is the kit that houses all this. Here's a couple cases. This is a case done here in the Midwest with a first-generation aspiration device for an iliofemoral DVT. There was lollipopping, couldn't get the specimen out, exchanged out for the iCHOR device, and here on the bottom right, you can see again a endo-fogarty technique for successful retrieval of this iliofemoral thrombus. Here's another case that highlights that it's cost-effective because it's done in an OBL. It also highlights the fact that here that the basket, once you extract your venous thrombus, you can bend it back on itself, and it's very easy to extract the specimen, as you can see here at the bottom right on the back table. So it's very nice. It's very quick. Here's a case, another iliofemoral DVT. You can see the balloon starting up here, probably just distal to the profunda here at the lesser trochanter. And this device is very good about not only fresh thrombus, but more organized thrombus as well. This was all extracted through that femoral DVT. Here's a case that with 2 successful eye sweeps, you have another successful iliofemoral DVT thrombectomy. Here's the basket, here's the sheath, here's the balloon coming down. Again, maintaining wire throughout. Once you get your balloon to the end of the sheath, into the basket, that's where you collapse the basket over the thrombus and then you remove it all together. Another highlight of this device is it's inexpensive and it's safe to go through iliac venous stents. As we all know, not all iliac venous stents not all devices can be used in iliac venous stents. So this is another nice advantage of this technology. Here at home, this was my first one, a iliofemoral DVT. On the back table, here's the specimen. We extracted after just 1 pass. We ended up doing 4 passes. Only took 25 minutes, and again, you just bend this basket back on itself, and it's very easy to successfully clean it out. Here we did about a week and a half ago, Josh, our senior resident. It took 40 minutes, took a little bit longer, I think, because Josh was just being very safe with the balloon. Once I got him to be a little bit more aggressive, inflating this compliant balloon, then we were able to extract out this iliofemoral DVT, and this was an outpatient procedure for this gentleman. At home, I also did an animal study, not so much looking at negativity of any particular devices, but more looking at the positives of the iCHOR device. We did an animal study, which is here on the 3rd floor of Good Sam. And one side we did mechanical thrombectomy of the common iliac vein. The other side we did an iCHOR device. We then harvested the specimens, sent them to an independent path lab, so the histopathology lab was blinded. as to what we did. And they called back and they asked what we did on one side, which that side had significant thrombi, inflammation, and necrosis in areas of the common iliac vein. Whereas on the other side, with the iCHOR treated vessel, all we had was mild to moderate neointimal hyperplasia, which is consistent with the open Fogarty research over the years. And again, looking at the summary or the histopathology summary here, it really makes you think. And it's a fair discussion. Are some metal dragging tools causing unnecessary inflammation and damage to some patients? Whereas the iCHOR device is just simply causing neointimal hyperplasia, which is something we've seen with the open Fogarty for 6+ decades. So going forward in 2025, as I mentioned, the 7 French arterial systems are going to be coming out probably Q2. 14 French venous systems already there and works quite well. It's nice that they're going to bring a 22 millimeter balloon soon so we can treat the more distal IVC DVTs as well. And also they have a 7 and 8 French dialysis system coming out too, which will be ideal for those nephrology outpatient dialysis labs because it's a cost-effective device, not requiring any capital purchase. So at the end of the day, these devices work. They will absolutely compete with the other market leaders. iCHOR is focused on lower extremity reperfusion when it comes to DVT, not so much about the PE space. Their devices are FDA cleared, and really what they are endo-fogarty procedures with something that's been tried and true for 6 to 7 decades. They have a strong platform coming, and they definitely have a best-in-class team and advisor team there at the headquarters. So again, I'd like to thank the Pegasus course directors for the opportunity to share our initial experiences with these endo-fogarty techniques and devices. So thank you so much.